So, what is hospice?
Hospice is, we refer to it really as a philosophy rather than a place.
Okay.
It's sometimes people will think of hospice as a place that you go when you have advanced illness and receive care,
Right.
and we do. There are hospice houses where people can do that. There are only a
Okay.
few of those around, but hospice is more of a collaborative effort of physicians, nurses, social workers, chaplaincy, volunteers,
Right.
that all work. We all work together to care for patients in a team effort
That's great.
to meet all their needs wherever their residence may be.
That's wonderful. So, people that go in there at first probably are frightened about it because they don't know that much about it. And you're explaining it very well, that it's something you don't have to fear. I mean, it's something that you're not going to go in and people are going to be scary. Doctor's going to be scary. You're saying, well, you only have 3 hours and 5 minutes left. I think that's important.
Well, people, I think statistics will bear this out if we go and search for them, but
Okay.
hospice may have the highest satisfaction rate of any medical specialty that there is, that people
I'm
really,
sure they do.
people really do appreciate what we do, and maybe, I know that I'm biased in this perspective, but people really do follow their hearts into hospice work. It's not for everybody because
Right.
it is very difficult
Sure.
at times, and
Absolutely.
but we do it because we really care about it. And I tell people that I'll do hospice until I'm 100, and
That's great.
as long as my brain keeps on
Right.
working and I can keep on moving, I'm gonna keep on caring for people because I love it.
Yeah.
And just about all of us who do hospice work feel the same way.
Well, I told you about my situation with my sister-in-law, how she has 3 children, and they were probably they were older than that, than your children, but, children don't always get along. And anyway, my sister-in-law, she had lost her husband the year before, and she had cancer, and it came again, and she went to the hospital, and I guess they wanted to reoperate, and she said, no, I want to end it. I've done enough, had enough. She was 80. And so she went home, and she had hospice at home. And my husband and I went down there quite a bit. We'd bring down coffee and all that stuff. I couldn't get over the children, adult children, how close they got, and how she was really at peace. And the people that came in from hospice were absolutely wonderful.
Well, I appreciate hearing that.
No, they really were.
I can tell you it's interesting. It's a little bit different. Well, it's different in a lot of ways from other areas of medicine, but the family concerns and the family needs are just as important as the patient's needs.
Right.
And the family sees what we're doing
That's
to,
right.
to care for the person that they love. Are we relieving their pain? Are we comforting them? Are we helping with their confusion or delirium if that happens? Are we dealing with existential pain, the sense of impending loss that they might feel, or unfinished business? And we do. And my personal feeling is the patient who may not have a lot of time left, sometimes they surprise you and they have a lot of time left, and we're very happy when that happens.
Sure.
But more commonly, the disease will progress because we can't stop it, and then that person will be at peace forever.
Right.
The family, though, is going to go on, and they're going to remember that person that they loved, and they're going to remember how they were cared for, and what I did and what my team did.
Yeah.
And I want them to feel good that we relieved their pain, that we comforted them, that we were there for them, and that the person that they loved and cared about so deeply was cared for by us in the best way we know how.